lost to yet another mass shooting in what has become a continuous cycle of tragedy in the United States of America. And we can already predict that they won't be the last victims. America's most recent horrific event in Uvalde, Texas, marked the 214th mass shooting in America thus far in 2022, a number that far exceeds the number of days that have passed this year. Of those 214 shootings, 27 were carried out in schools. This latest tragedy, coming just 1 week after the slaughter of 10 black people by another mass shooter in Buffalo, New York, took the lives of 21 people, 19 of whom were young children. While our hearts go out to the families of the victims and the traumatized survivors, we remain utterly incensed by the knowledge that another, and likely even deadlier, mass shooting lurks ahead of us. It seems that as many states rejoice in their aspirations to protect the unborn by passing restrictive legislation to ban abortion, with future plans set to limit or outlaw contraceptives, there is little political will to tackle the epidemic of gun violence that is killing the already born. Guns, we are told, are not the problem. It is our nation's mental health crisis that is to blame, along with our departure from God's grace, of course. According to many politicians, more prayer and a return to biblical values is the solution, not banning guns or imposing common sense gun control provisions. Neither Republicans nor Democrats have the political courage or human decency to do a damn thing to curb the tragic loss of life and needless suffering endured by so many Americans. And this feckless failure of leadership isn't just limited to gun violence. It extends across all veins of our societal system, from socioeconomic woes, poverty and hunger, the climate crisis, environmental degradation, and perhaps most consequential, our dysfunctional and lethal healthcare system. Gun rights advocates and many politicians love to blame the ever-rising surge of mass shootings on, wait for it, America's mental health crisis. And to be fair, they make a good point. The United States does indeed have a poor record of caring for its citizens' mental well-being. It's no huge surprise that there are people performing desperate and senseless acts in a country where 2 out of 5 adults report symptoms of anxiety or depression. A staggering 40% of Americans who have suffered a history of severe mental disorders lasting 12 months or more do not receive any treatment. And even the young are affected by our nation's psychological downward spiral, with 1 in every 5 children now being diagnosed with a mental disorder. Between March 2020 and October 2020 alone, mental health-related emergency department visits skyrocketed by 24% for children between the ages of 5 to 11 and 31% for those ages 12 to 17. Sadly, it's reported that only about 20% of these diagnosed children receive any treatment for their conditions. These numbers can't be ignored, and serious research must be conducted to figure out the reasons behind our country's decline in mental wellness and the solutions to making ourselves feel better. Yet the rhetoric emanating from the corridors of power about America's struggle with mental illness seems to be no more than a distraction, a convenient scapegoat to evade responsibility for the gun violence epidemic and other social problems. Now, of course, if our leaders were serious about combating the mental health crisis in this country, they would be forced to also acknowledge that mental health is only the tip of the unwellness iceberg. They would have to admit that America's entire healthcare system is an unmitigated catastrophe, a cornucopia of dysfunction and inequity. Here are just some of the facts about our healthcare system in the United States. The U.S. substantially outspends every other wealthy nation on healthcare. Americans are nonetheless living shorter and unhealthier lives. The biggest impediment to wellness in our nation is inaccessibility to care, which of course stems from our for-profit healthcare system and the high cost of treatment and medications. Consider this, per person, spending on healthcare is growing 2 times faster than household income. hospital prices alone have increased by 600% since 1980, burdening Americans with the world's costliest access to healthcare. That's right, the world's costliest access to healthcare. Also consider that a family earning $45,000 a year must budget no less than 20% of their income for health expenses. More than 75 million Americans have had to cut back on their household spending just to pay for their medication, never mind the insurance premiums, deductibles, copays, and out-of-pocket costs. 48 million Americans report being unable to afford to fill their prescriptions and are either rationing their medications to make them last longer or doing without it altogether. You know, for a nation that claims to care so much about the sanctity of life, 1 in 4 Americans actually risk their lives by foregoing necessary healthcare treatments because they can't afford them. This is one of the primary reasons why American life expectancy is ranked 28th among 36 developed countries. Now, many of my conservative and neoliberal friends will dismiss this figure as misleading, pointing out the high suicide rate. But in multivariate models that assess the association between suicide rates and the availability of access to health care, results show that the state rate of federal aid for mental health was, of course, the strongest indicator, followed by the rate of uninsured persons. In other words, the inaccessibility and high cost of healthcare is integrally linked to suicidality. Moreover, the United States has the highest rate of avoidable deaths than any other developed nation, along with the highest chronic disease burden, and an obesity rate that is 2 times higher than the reported average by the OECD, which is the Organization for Economic Cooperation and Development. A new report from the National Academies Institute of Medicine finds that Americans without insurance, or those who are underinsured, are far more likely to have poor health and die prematurely than those with insurance. Even being uninsured for a year seems to diminish a person's overall general health. It is indisputable that our current approach to healthcare is killing Americans at an unprecedented rate. In fact, 34 million Americans know either a family member or close friend who has died in the past 5 years after being unable to afford healthcare treatment. Spending on healthcare isn't just hurting average Americans, it's also crippling business and economic growth. Businesses will spend an estimated $810 billion to support employee healthcare this year, and that doesn't account for the lost productivity resulting from sick employees. It's perhaps why Warren Buffett calls healthcare the tapeworm of the U.S. economy. It is estimated that by 2040, employers will spend as much as $2 trillion on employee health coverage. Now, perhaps you're one of the privileged few who enjoy a high income bracket and have excellent healthcare coverage. Affordability isn't an issue for you, so why should you care? Well, consider this. Numerous studies have shown that even modest expansions in Medicaid have led to economically meaningful reductions in the rates of robbery, aggravated assault, and larceny theft. Following the expansions in Medicaid under the Affordable Care Act, police arrests declined significantly, producing 20 to 30% reductions in arrests in the first 3 years alone. Study after study shows that broad health policy reforms that make healthcare more accessible and affordable can reduce our reliance on the criminal justice institutions in our country, keeping our communities healthier and safer. These studies aren't new. The results have been known for years and in some cases, decades. So we know what the problem is. We know that it's killing Americans at a staggering rate. We know that it's making our communities less safe and increasing our reliance on a costly criminal justice system. Furthermore, we know that it's crippling economic and business growth. We know what the solution to the problem is, and we know that this solution is far less expensive than our current system. So what in the hell is preventing us from joining the rest of the developed world in implementing universal healthcare coverage? I wonder, could it have anything to do with the nearly $700 million spent last year by the healthcare industrial complex on political lobbying? Is the high cost of American medications possibly related to the fact that the pharmaceutical industry is among the biggest spenders when it comes to lobbying politicians, followed by hospitals and nursing homes? Might the lack of political courage and willingness to enact proposals such as Medicare for All actually be corruption by our elected leaders? Imagine that. Treating healthcare like a commodity means that healthcare decisions are dictated less by science and more on what the market's financial incentives demand. The current economic rules of our dysfunctional medical market are as follows. Number one, more treatment is always better, and of course, always default to the most expensive treatment options available. 2, a lifetime of treatment is preferable to a cure. 3, amenities and marketing matter more than good care. 4, the more technologies age, the more prices rise. 5, there is no such thing as free choice. As a patient, you are stuck with the options your finances and the market afford you. 6, more competitors vying for your healthcare business doesn't mean better prices, but it can actually drive prices up, and it often does. 7, economies of scale do not translate to lower prices. With their enormous market and political power, big providers can simply demand even more. 8, there is no such thing as a fixed price for a procedure or diagnostic test, and the uninsured, of course, will be billed at the highest rates. 9, there are no billing standards. There is money to be made in billing for anything and everything. And finally, 10, healthcare costs will rise to whatever the market will bear. So this nonsense that we hear about the inherent capitalistic freedom in our current system, well, that's just a myth. Now, in the beginning, the concept of healthcare was actually much different from the beast of burden that it is today. In her book, In American Sickness, How Healthcare Became Big Business and How You Can Take It Back, Elizabeth Rosenthal details how our current medical insurance system came into existence. The origin story is fascinating, but the well-intentioned end result, of course, is tragic. Rosenthal tells us that, quote, the original purpose of health insurance was to mitigate financial disasters brought about by a serious illness, such as losing your home or your job. But it was never intended to make healthcare cheap or serve as a tool for cost control. End quote. As I'm sure you can easily guess, our capitalistic, profit-driven society instantly spotted a means to make money and a plan designed originally to help the average American survive. The founders of the once non-for-profit Blue Cross Association nearly a century ago had no idea how their innovation would evolve into the chaotic system that exists today. Instead of simply aiding a nation that should have been developing in the direction of keeping its citizens healthy simply for the good of the country, the medical health insurance industry was warped into a monster that has held America back socially and medically progressing. And it's killing people left and right in the process. So while many politicians are so quick to blame the epidemic of mass shootings in this country on mental health problems, you know what? I'd have to agree with them. There is a true crisis, and it involves the mental health of those whom we elect, who have an untreated case of greed and corruption. And that, my friends, is the last word up front. I'm Sean St. Hart, and you are watching, or maybe listening, to Coup Save America. Stay tuned. We have got a great show ahead as we continue this conversation about inequities in healthcare. Our guests today are Dan Lehrman, a retired medical and mental health licensed clinical social worker, and the current chief executive officer of the Healthcare Voice that is committed to advocating for the un- and underinsured. Dan has talked to and interviewed over 100,000 patients and is going to offer his unique insight into our dysfunctional healthcare system and, of course, make the case for Medicare for All. A little later, we will be joined by another friend, Alan Kramer, who is a former healthcare administrator for a hospital in Canada, who will help us to better understand Canada's healthcare system and dispel some of the myths. First up, directly following our news that wasn't in the news segment, we are going to be joined by Michaelangelo Hamilton, a Bernie-crat running for Congress in Florida's newly drawn 23rd Congressional District. Michaelangelo works as an independent Medicare Advantage sales agent and has his own unique perspectives on America's healthcare system. And I bet he's also got a thing or two to say about the shooting in Uvalde, Texas. We'll be right back.
Coup Save America. Oh, God's gonna need every week. Working will do for the latest news. To understand economy and politics. This is Coup Save America.
In the self-professed land of the free, as we are told, so to speak, numerous anti-protest laws have been creeping into existence throughout the United States in recent years, as, of course, a retaliatory strike against the growing movements for social justice. There is a burgeoning new anti-protest lobby seeking to suppress dissent. These anti-democratic assaults on free speech and the right to protest range from seeking to impose draconian criminal penalties for protesters to providing alternative defenses for drivers who, you guessed it, run down protesters. Literally legalizing murder in this country. Imagine that, murder in this country from the same people that are so quick to profess the need to protect the unborn. One of these proposals can be found in the Senate Bill 171 and House Bill 289 in Georgia. Both, fortunately, died in 2022. Now, Louisiana, it seems, is likewise intent on allowing its citizens to murder social dissidents with the introduction of House Bill 101 that proposes and provides a similar new legal justification for killing protesters. In a nation with more guns than citizens, what could possibly go wrong with these proposals? In another bill in Arizona, Senate Bill 17, which was passed back in this year, 2022, imposes new penalties for protesters demonstrating near gas and oil pipelines. I wonder who's paying for that lobbying effort. The Center for Media and Democracy has recently launched an anti-protest lobby tracker that's designed to help researchers, journalists, and citizens shed light on the special interests behind these anti-protest bills. You can find this tracker at antiprotestlobby.org. Once again, that's antiprotestlobby.org. In other news, the violence that has characterized the state of Israel since its establishment is nothing less than extreme and overwhelming. The emergence of various security agencies, such as the Mossad, the IDF, and other commando-style units that are really little more than glorified terror squads, which the United States knows a thing or two about as well, are renowned for their ruthlessness against Palestinians. And yet, despite these agencies, it seems that Israelis are not quite fully content. Many are feeling that the enormous security apparatus is wholly insufficient and calling out for Israeli citizens to take up arms. Gee, that sounds familiar. More alarming, though, are the recent reports on the surge of civilian-run militias, also seems rather familiar, which are already operating in Palestinian communities. There is a new investigation by Jessica Buxbaum of Mint Press News, which reveals that money from tax-exempt American charities is finding its way to groups that support Jewish terrorism in Israel. To learn more about this story and the organizations that are in her report, please visit mintpressnews.com. And that, of course, concludes this week's news that wasn't in the news. And it is now time to bring in our special guest and future Congressman Michaelangelo Hamilton. I'm doing great. So I'm very excited. You are going to be our next congressman in Florida.
One could hope to be. Absolutely. Absolutely. Appreciate you having me.
No problem. Thank you for coming on. So tell us a little bit about yourself and your campaign. Now, you're a fellow Bernie-crat.
That is correct.
You've got probably most of my audience's support already. Of course, they have to live in Florida, but tell us a little bit about yourself. Now, go ahead. Tell us a little bit about yourself and your campaign and what caused you to run.
Well, first, I want to appreciate you for having me. First of all, I've been a Bernie supporter, of course, since I was very young, since I was 16, traveled to Iowa with local Floridians of mine, and just been very involved in politics since I was very young. And, being in elementary school, I always thought that was a career choice for me. Got educated here in the district at Florida Atlantic University, majored in political science, and now with this opportunity, our congressional seats opening up, and I'm interested in running for all of the people of the district and of our country. So that is my purpose and reason to run, and it's really to help bring progressive change to our country and to the district.
One of the things that I find fascinating and inspiring about your campaign is your personal history as someone who has actually experienced growing up in an shall I say impoverished? Is that a fair word?
That is a fair word. It was really hard growing up. My mom was a single mom. She stayed to take care of us, make sure that we stayed out of trouble, got our education. I was homeschooled for part of my educational background. And then I was in public schools for, all of my life as well, public university. So I'm a product of the public school system. And, my father was a doctor at Jackson Memorial Hospital. He was a state military. Yeah, he was pretty smart. He immigrated to this country, believed in America, believed in the promise of America. So I come from a military background as well. My ancestors fought for this country, defended our country, and this is a way for me to enter public service. I would say that's going to be my contribution to our country as well.
Now, you're not a millionaire or a billionaire, though. That's going to be kind of a different environment for our lovely Congress that's full of millionaires, isn't it? Oh, we've lost. Oh, there we go. We get you back. Sorry, go ahead. We lost you there for just a second.
Oh, okay. No, I think it was my connection. I think it just froze up a little bit.
So let's talk about. I know that you're very obviously you're probably a supporter of Medicare for all or something of that nature.
Yes.
And
yes.
And that's why I was kind of fascinated when you said that your father was a doctor, because that must be an interesting perspective that he brings to this as well. Then,
well, he passed unfortunately when I was very young, but being
I'm
around
sorry.
him, yeah, no, it's okay. I still have good memories and stuff like that. He would definitely be someone who was very educated, who would like to read a lot. I'm sure that perspective would be important as well. But right, he passed when I was 3, so it's all good.
Oh, I'm sorry. Now let's talk a little bit about the recent shooting in Texas. Now, coming from Florida, which is I hate to use the word red blue state, but a red state for all intents and purposes.
Right.
One of the states that's also been passing a lot of laws making it easier to get guns. What would you bring? What do you think? What would you do as a congressman in terms of resolving or reducing these shooting events in this country? What do you think the correct path forward to that is?
Well, that is an excellent question. I do believe that we must end the gun violence in this country. The district I would be representing has Parkland included. I was there for Parkland 4 years ago. Yeah, yeah. I was there for Parkland 4 years ago. I've lived in South Florida all my life. So, I've made some meaningful connections there as well. And just being a part of what's been happening over the last 4 years and going to college and getting myself educated, I would definitely say we have to look at, legislation. Banning assault weapons is an option we can look at on the table, and strengthening our ability to prosecute these people to the fullest extent of the law. Maybe, creating more federal law and more federal legislation to ensure that we don't mess around with these domestic terrorists, because that's what they are. Anyone who incites terror in our country are domestic terrorists, and we need to treat we need to treat them like one. So that's my stance on that.
What about what about even going after the gun manufacturers? Any kind of criminal type penalties for them? I mean, because if you look at the gun manufacturer involved in this recent tragedy in Texas, they have a history of advertising to some pretty towards some pretty extremist kind of leanings. Seems almost kind of that they should bear some responsibility, correct?
Definitely, that is definitely something I will look at for sure. The gun manufacturers do have some sort of role to play here, and I would definitely be open to that sort of legislation if elected. Absolutely.
So now your new district is how would you
Describe it.
how would you describe it, like politically and so forth? I mean, is it a high heavy towards the Republican side, or do we not know yet?
That is a great question. So our state just finished drawing up the lines. They were having some litigation with it. It doesn't look like it's going to happen in time for the congressional district to change. Our district is not going to be affected. So the new lines are West Boca, the city of Boca, the incorporated parts of Boca Raton, Deerfield Beach, Pompano Beach, Coral Springs, parts of Fort Lauderdale, Lighthouse Point. So basically all the beaches along the coast, and then you go a little bit more. The new areas is West Boca. That used to be with Louis Frankel, but now that's part of my district as well. So unincorporated Palm Beach County, incorporated Boca Raton, Parkland, Coral Springs, Margate, Coconut Creek. Those are the areas that would be voting in this very important open primary. So it's an open race. So.
Tell us about your opponents.
Well, the main contender is Jerry Moskovitz. He used to be the Florida Emergency Management director here in the state of Florida. He used to be a state representative. Then there's two other candidates as well in the race. One of them, I believe, served in the military also, so that's a little similarity, family heritage, I guess, in my side. But yeah, I mean, those are the main candidates. It would be myself and four other people. And I would definitely love to, start my campaign, which I'm doing right now with you. And I would definitely be sharing my message to all of the people in this very important Democratic primary. After what happened in Texas last week, that definitely solidified my soul searching after college, deciding what I want to do with my life. And this is a once-in-generation opportunity, and I decided I have to take it.
Yeah, and I don't want to be ageist, but there seems to be a generation gap in this country in terms of who's representing us. And it seems to me that we're denying, in a sense, the younger generation. I mean, it's your future, right? And yet we've got these almost oligarchs, if you will, that are trying to stick with the status quo. And from my perspective, we need younger people in office. We need people that have a whole new perspective, because the world has changed. I mean, let's talk about Nancy Pelosi, for instance. The world has changed substantially since the time that she was, your age. I mean, her generation has had, their run, if you will, and yet they're still taken away from the younger generations. what do you think, younger generations such as yourself have to bring to the table in terms of what we currently have?
Well, I definitely believe that we need more young people in office. We need more people from Generation Z. I'm from Generation Z as well, and definitely in Congress. I think I know one other person running in Florida who would also be joining me if we're both elected. And having our perspective in the 118th Congress would be very important to our country, especially with everything going on, with inflation, with the mass shootings that don't stop in this country as well. So I definitely agree with you. This will be a very important race. It's all hands on deck, and definitely believe we need more people like us, and people of color as well. We're underrepresented. Latinos. I'm a Latino as well, and minorities as well as underrepresented. So this is a very important thing for me to do. It's a very ambitious goal, but it's something I believe in fully and wholeheartedly, and that's why I decided to do it.
What obstacles have you faced thus far? Is there a lot of money? I imagine at some point a lot of money is going to be pouring in to these campaigns.
Oh yes. I don't want to call out some of these other candidates I'm vying against, but one of them already has a super PAC, and that has to tell you that they're not going to be 100% for the people. So I'm the only serious candidate I would say in this race who has the potential to win. I've had connections. I've interviewed AOC before she won in her congressional campaign when I was right before joining college, and other people who are role models to me in this Congress. So I would say I'm the only serious right now. I'm the underdog of the underdog, but when all's said and done, I think I might have a real chance of winning the seat. So now, to answer your question a little bit more, going back, it takes a lot of money. Yes, that is very true. The laws are the laws, but right now it's either petitions or deadline. Unfortunately, already passed. So the next option is the qualification fee, which is about $10,000, give or take. So for these big races, they make it a little harder than a lot harder actually than all the other races, of course. So, but it's very important. So I decided, let me commit to the goal. Let me figure it out. Let me get the message out, and I appreciate you giving me this opportunity.
Yeah, this impediment to running for office is just disgusting, especially in this a nation that considers itself a democracy.
Exactly.
And the big money pouring in, it really does. I mean, there's no question that the scales are slanted against progressives, right?
Right.
So what can we do to help you get elected? What can we do? I mean, obviously, donating to your campaign is important. What else can we do? And how do we donate to your campaign, by the way?
That is a great question. So right now, I have an Instagram, Michaelangelo for Congress. So if you Google it in Instagram, you can also look at my website that will be changing at michelangeloforcongress.com, or follow also michelangelohamilton.com. Those two websites should get you pretty in the loop of what's going on. And definitely we're going to need a lot of volunteers, phone banking. I'm hoping Justice Democrats gets a hold of this. I emailed them, have some people in the district, vying for me as well. So we're going to do the best we can, and we're going to keep pushing for progressive change. And maybe we have the chance of making history, not unseen for centuries in this country. You have to go that far back to all the way to the Andrew Jackson time. When Andrew Jackson's seat left in Congress, when he resigned, it was an open seat, a 22-year-old won and served in Congress. So that's what I'm hoping to do. I'm 22 right now, and I'll be serving when I'm 23 in 118th Congress.
Yes, no, absolutely. We need to get you elected because we need more people like you in office. It's been so discouraging to see so many of these races, like with Nina Turner, for instance. I mean, that was really disappointing to see her loss. And a lot of that has to do with again, this outside money pouring into these campaigns. And it scares me. Let's just put it that way, because we're not getting people that are representing, their constituents. We're getting people that are representing their donors.
Exactly.
So if you had to, if let's say that you were on a debate stage right now and you were asked what your
Okay.
three most important issues are that you want to tackle, what would they be?
I would definitely say inflation, increase in American wages, and ending gun violence in this country.
Very good. Those are very good positions. Of course, there's
Thank
a
you.
lot of them. um, yeah. Now let's just talk about real quick inflation. What do you think is driving inflation right now? Because we're being told that it's the Ukraine war. We're being told,
We've
um,
been told a lot of things, right?
yeah. What would you?
Right.
I mean, what do you think can be done to curb inflation and to get Americans a decent living wage?
That is a great question. I definitely believe, as far as the pain at the gas pump, the Congress has to be doing more to alleviate the pain. We have to look at legislation to possibly tax these oil companies, have a discussion with these oil companies, do something because something's definitely not working. And that is something I will look at. Also, as far as increasing American wages, we need to make sure that we look at raising the minimum wage. Is long overdue for a raise in the minimum wage in this country. Our federal minimum wage is what, still like $7.25. It's unbelievable. So we need to look at that, and these are issues, since I remind you, Sean, like since I was like a toddler, maybe, and it still hasn't changed. And I
And they're
went
getting
through
worse too.
college, and I have to be fighting for all of that. So it's going to be an interesting campaign and interesting terms, hopefully. And I'm going to do everything I can for the American people. I'm unbought and unbossed, and that's where I stand. So
Now,
absolutely.
some of my viewers and listeners are going to ask, because they've been somewhat disheartened with the Democratic Party. They could ask, why run as a Democrat? Why not run as an independent? What would you say to them on that?
First of all, that is an excellent question as well. I would definitely say running as a no party affiliate candidate presents a lot of difficulty, especially within our two party duopoly. Unfortunately, it's not feasible. They make it so hard, and and it's just the way our country is structured is just too structured for a two party system. It would take a lot of resources to be able to pull that off. And you could take a look at what Ross Perot tried to do back in the day, as a no party affiliate when he was running for president. He spent a lot of money. I don't know how much, but he spent a lot. He was rich, and he was able to
Yeah.
get you know the job. So running as a Democrat in this primary presents me a real opportunity to win the nomination. And since it's a Democratic district, D+9, so it's a Republican area, with the beaches and Boca Raton. But then when you go west, Coral Springs, Parkland, it's Democratic. So it hasn't changed that much. And if I win this nomination, I'll probably be joining the 118th Congress. So looking forward to do the best I can for everyone.
Do you think that Florida now? I mean, because we hear all the time, well, Texas is turning more blue and Florida is turning more blue. Do you see that?
Well, I would definitely contend that South Florida is the bluest part of our state. The Palm Beach County or Broward County, some parts of Miami-Dade. What happened recently in the last 2 years was very interesting to see in the presidential race. Trump got more support in the Miami area, unfortunately, than the last time. So the Republicans are picking up some steam. Definitely North Florida is traditionally very Republican. You got Matt Gaetz.
No.
And what they did, and what I'll say, I'll stand with also, those who were drawn out of their congressional districts. Not drawn out, but they were, they were drawn out. Like, they were like disenfranchised. That's the word I'm looking for, from the system. Traditionally, due to our federal law, these were districts that were created to protect the minority vote, to protect the minority representation, rather, I'm sorry. And I guess our governor didn't really like those two congressmen or that congressman that much, and they were able to, unfortunately, get the way they wanted. So, because, that's the way things are in this state, unfortunately. It's mostly Republican governorship, usually Republican House and Republican Senate. So,
Why
unfortunately,
is
that's the
that?
case.
I mean, what are the issues that are driving people to vote Republican? And I mean, I know that that's kind of a strange question because there's a number of factors, but
Right.
is it just geographic? Is it culture? Do you think? Is it? I mean, is
I
it
think
like?
it has to go. I agree with you. I think it has to go back to like your other question about why third party candidate doesn't really have a chance is because of a lot of culture. It's a lot of just being around family. Like for example, if you grew up in a Democratic household, you're probably going to turn out Democrat. And then you're not really going to give it a second thought of how the system works or if you should be an MPA or all the other parties that are out there. So I think that happens a lot in this country. Our founding fathers actually didn't even believe in political
Yeah.
parties. So, you know, yeah, I mean, that's probably why. And also you have, I can't speak to Republicans because I'm not a Republican, but I mean, that's probably the main reason why I would say, to answer your question.
Now, is there anything on the Republican platform that you agree with on Republicans? I mean, that you
Oh,
would be
wow,
willing to
that's a great question.
like work with them on a
Um,
bipartisanship basis?
to work with them, I believe the working class Republicans, the Republicans who are not the politicians, I can definitely work with in the district, my constituents, but the Republican politicians, I'm going to definitely do my best, like, for example, we need to be increasing wages. I'm sure everyone agrees with that, so different issues we can work together on. Unfortunately, the main National Republican Party has been dominated by the former president. And I think that did a very large, large disservice to the Republican Party. I mean, what happened to the Republican Party of Lincoln and the Republican Party of Arnold Schwarzenegger and the Republican Party of the back in the day, that they stood for certain principles. Now it's all about one man. And that's how I feel the Republican Party is right now. It's all about one man and whatever that one man says. And to be on the record, I believe January 6th was a disgrace in our republic. And, to provide a Gen Z perspective on that, I was in college at the time, and it was very scary. Me and my classmates didn't even know if this country was going to survive that day. Those were scary 12 to 11 hours. And
Yeah.
that's another reason why I'm running, I would say, as well. I mean, we can't let that stand in our country. Anyone who commits terror or tries to incite violence or any of those things should not be allowed to stand in this country.
Well, they certainly should not be allowed to run for office again.
And that's another thing. Oh my God, that's crazy.
But so you have it. So once again, just tell us what can we do to help? Where can we go to help you? Let us know that one more time.
Sure. MichelangeloforCongress.com, MichelangeloHamilton.com. You can find me on Facebook, Instagram, pretty much anywhere else on the internet. And I would love your support. We're going to need help with phone banking. Any donations right now is top priority to qualify on the ballot. And hopefully we'll get some of our progressive groups to come in and endorse as well. And that way we can have a lot of support and get this race going because I feel like we have a real chance, I would appreciate all your support. I appreciate you, Sean, and I hope you're having a great, amazing show here. I don't know if that was the last question or if that was
No,
all.
yeah. We'll let you go now, but you got it. Please let us know how your campaign is going. We want to continue to
Absolutely.
support you, and hopefully you'll come back after we get you elected because you are going to be our next congressman.
Thank you so much. No, I really appreciate it. Looking forward to it. And go Progressives. I appreciate it. Thank you.
Right. Thank you so much. You have a great day. Bye-bye. God bless. Okay, now we're going to be going to our next guest. We're going to be bringing in Dan Lehrman, and I'm very excited about this guest. So, Dan, are you here?
Hello.
Ah, it works.
Awesome.
How are you?
Sean, I'm good, and I hope you are too.
I'm doing great. So I've been looking forward to talking to you. Obviously, we've talked and I appreciate you coming on this episode. It was a little bit last notice. Tell us a little bit about yourself. I mentioned you are a former social worker, and you're also part of the Voice for Healthcare. Tell us about that organization.
Right. I apologize. You broke up the audio, maybe about half of it. Just try it one more time.
Yeah, I think we're having some issues with the internet connection.
I hear you clear now.
Can you hear me?
I heard you when you said,
okay.
Can you hear me?
That's going to be the new name of this podcast. Can you hear me?
Can you hear me now? We'll have to get a telephone corporation to fund the show.
Yes. I was asking about your organization and just a little bit about your background. Yes, healthcare.
Right. Okay. Let me, with your kindness, how did I actually get interested in all this? Well, it was like back in, believe it or not, 1985. I was living in California, and I became aware of a woman who had breast cancer, and she had requested to have a bone marrow transplant, which was an appropriate request. However, the medical director of the corporation, as well as he was a high-level administrator, had denied the request. And so a medical decision, it turns out, was made based upon not in the patient's best interest, but it was primarily financial. Well, the woman did pass away and left 2 beautiful children. Her son happened to be an attorney, and with no experience or background in these issues, he decided to challenge the decision and in court. And to make a long story short, he was awarded $22 million in the state of California. Now, I'm sure they settled for less,
right?
But he proved beyond a reasonable doubt that the decision was made so that he could get a bigger bonus and to save the corporation money. Well, it was at that time that the connections were made with me. Unfortunately, when I was 19 going on 20, my mother passed away from breast cancer. It was a late diagnosis and treatment, but that can happen. But between the two connections of this young lawyer and my mom is when I really first started to become interested in this whole issue of profit over people.
Yeah, and that's really what it's about.
Unfortunately. So the healthcare voice is basically, I spent 25 years in public service working for the Department of Veterans Healthcare Administration, over 25 years. And towards the end, starting in 1985 and beyond until I retired approximately from the VA approximately 17 years ago, I really did become known as an advocate within the VA healthcare system for patients, for families, and for dedicated healthcare providers and their support staff. And that's what I've been doing within the VA healthcare system, as well as enjoying my practice in home healthcare and doing some volunteer work and some pro bono work. Just trying to be a voice and an advocate for people doing some problem solving with one patient, one family at a time. I am retired now. But occasionally I do some pro bono work.
How many Americans do you think pass away every year because of the same story?
Well, late diagnosis and treatment due to lack of healthcare insurance. And before we proceed, I just, and I did talk to your producer, Mackenzie, about this. I want your audience to know that while I've worked in healthcare for decades as a licensed clinical social worker, I don't consider myself to be per se an expert in Medicare for all. But having said that, I've seen and heard about so many stories, and of course I have both the personal and professional interests, that I felt like I could come on the show and, for lack of a better words, hold my own. I did take some notes for myself, trying to make perhaps over-preparing rather than under-preparing. But there are probably, and I did take notes on this, so you'll excuse me if it looks like I'm looking down at some of my notes. The number of deaths, according to Physicians for National Healthcare per year, are approximately 45,000 people in the United States, to answer your question.
Yeah, and I would imagine that it's probably much more than that. It's really hard to quantify that, but 45,000. Even if it was 45,000.
No, I'm
we're
sorry. If
talking
I
about
said thousand, I apologize. 46 million.
Oh, 46 million. Okay, yeah, that sounds.
I apologize.
No, that's okay. I might have misheard you as well. So in as far as being an expert on Medicare for all, I mean, considering that we don't have it, I think it would be impossible for anyone really to be an expert on that field. I think we have experts on those that are saying this is why we shouldn't have it, so-called experts at least. Every other developed nation,
yes,
including a few that are not so developed,
yes,
have a universal healthcare system in place. And yet America treats that as though it's some untested experiment that's always gone awry, and the costs are unaffordable and wait times are too much, and no, we can't, because we got to have freedom, freedom in America, freedom and choice with healthcare, which again is a myth, because there's not really any freedom unless you're uber wealthy and can afford to go wherever you want to go. And President Kennedy, he indicated the need to go to a universal healthcare. I mean, it wasn't called Medicare for all per se, but he proposed something very similar to that. And yet here we are in 2022, and we still do not have any kind of. I mean, and the insurance industry is just getting bigger, more powerful, and things have actually degraded. So, we know that the cost of Medicare for all. I mean, studies have been done on this, including by the Koch brothers, ironically, and these studies have shown that Medicare for all would actually save money. So why are we not doing this?
That is absolutely true. Well, I don't want to oversimplify the answer. It's a simple question, and it has a simple answer. And the simple answer is the reason why we're not doing it is because of money. I'll give you just a couple of recent examples. In the state of California, the governor was really stepping up to the plate. The governor that's there now, stepping up to the plate to try, just for the state of California, a Medicare for all type of program. And unfortunately, he's pedaled back on his political promise to go for it. Why? Well, the paper trails were transparent. He received large donations from various sources. I don't feel it's appropriate for me to be online and tell you exactly what companies, what corporations, but it was from the hospital industry, and it was from the pharmaceutical industry, which, by the way, as you probably know, because I'm sure you've done some homework, that the hospital industry and the pharmaceutical industry, and thirdly, medical devices, have turned out to be, especially over the last 5 years, the most awful reasons for people having to spend a lot of money. So he took, not illegally, money, because the laws are what they are. And, people can say, well, the politicians got bribed and it's illegal. Well, the laws allow for all the senators, all the congressmen to accept money from the companies and the corporations that to this day do not want Medicare for all because they feel like it will hurt them or their stockholders. It will harm them. Well, of course, you and I have common ground. That's too bad.
Well, let's talk about that. So, obviously, this would hurt the insurance industry. There's no, which again, I don't care. I care more about protecting human life and making sure that people have the health care that they need. But when we look at the pharmaceutical industry, again, other countries have a Medicare for all type system. How do the pharmaceutical companies fare there? I mean, I imagine they're still selling their wares.
In general, and I'm going to generalize, the industrialized countries of the world, whether it be Canada or the European nations, in general, people pay approximately 40% less for their medications. That's a lot of money. We know today, as an example, that the pharmaceutical industries, and don't get me wrong, some of the pharmaceutical industries over the last 30 years, they've done tremendous things for many, many people. So we don't want to, pretend like they're of no good. They, in fact, have created wonderful things to help people. Unfortunately, it's the cost, and it's the stockholders. So insulin, as an example, there are still so many people here in the United States that, especially if they don't have health care coverage, they don't have access to programs and coupons and this, that, and the other for whatever reason, and so they're skimping on their medications. They're cutting back. Or sometimes people aren't buying as many groceries as they'd like to, or they're going into financial debt. I mean, the list is endless as to the pain and suffering that so many citizens and Americans have suffered in this country since, unfortunately, back in the day, 1973, it was illegal to profit off of healthcare.
Really?
1974, one of our presidents just had a friend by the name of Permanente. Well, Kaiser Permanente, of course, is one of the hugest insurance companies and network of hospitals, healthcare providers in the United States, especially on the West Coast. Well, Kaiser Permanente and the president at this time made a deal making it legal to profit from people who have accidents, diseases, and illnesses, and eventually making fortunes of money off of these problems for so many Americans.
I recently was shocked to learn, and that's because this is there's a great clinic here in Washington State that I think would be a good model for healthcare. It's called the Everett Clinic, and it's just fantastic. I worried, however, though, because a few years ago, they were being purchased, and that purchase did unfortunately go through. And I actually talked to one of the physicians that was, she's a dermatologist, and she was on the head of the dermatology department. And so she was on the board that was considering debating this. And I don't know the full details, but what I was shocked to learn was that the company that was buying the clinic was an insurance company, which to me seemed like a huge conflict of interest. And so I looked into it further, and it turns out that this is a fairly common practice. There's a number of clinics and hospitals and private practices that are owned by insurance companies. That's just such a conflict of interest right there, and especially the fact that most patients aren't even aware of that. What's going on there? I mean, that to me, again, the conflict of interest part aside, it just seems insane to me that an insurance company is buying up, these private practices and hospitals. I mean, how long has this been going on, if you know?
Well, I don't know, but the issues here are that the laws that allow for this to take place are in fact written by lawyers. These, and by the way, I want to make something else clear. When a person needs a good lawyer, fine by me. So we don't want to I don't want to come across blankets that, all lawyers are part of the problem. They're not. In fact, some lawyers are actually part of the solution, but they're up against a tsunami of money. They're up against a tsunami of money. These laws allow for insurance companies to buy these individual practice groups and larger practice groups. And not just the insurance, well, even medical corporations. I'll just throw out two, HCA and a Tenet, just as an example. They buy up these practices. By the way, I want to say that I see a cardiologist in Jupiter, Florida, and his practice is owned by Tenet. So they don't do all bad. It's just that there's so many opportunities to make massive amounts of money, massive amounts of wealth, and it's legal. So until there's some type of movement that is going to really push the ball forward and over the red line, so to speak, we're going to continue to see these types of things happening in our country. People want to see politics out of the healthcare system, but until that changes, I don't see the green light at this time, although the movement is growing. I'm not a gambler, Sean, but I'll tell you just a quick story that in 1985, when I became interested in everything that we're talking about and then some, I made a prediction in 1985 that by the year 2020, we would have resolved these problems. Well, unfortunately, now we're going into 2022, and in some respects, we're closer, but in other respects, because of everything that is going on in our country today, and I'll just be blunt, there's 76 million people that we know, as you and I talk right now, they would be thumbs down on Medicare for all. They believe in freedom of choice. They don't understand the dynamics of what we're talking about. Their own families may be suffering, and they may be going through all kinds of, stress, worrying about bills, but they're not voting. They're not voting the way we would like to see. And the polls, thanks for letting me continue to talk here, the polls talk about more and more people wanting to support Medicare for all. My observation is that it's not being shown and it's not being demonstrated at the voting booth.
Right.
And so you can say that 70% of Americans want Medicare for all. And maybe that's true, but when it comes to pushing the button and seeing people actually voting for candidates that are not only promising to make a better effort towards improving our country in healthcare, until the candidates come forward and keep their promises. I'll give you an example. Our vice president, she really was talking about, moving forward on a platform for Medicare for All. Not that long ago, something happened. I wasn't there. I wasn't privy to it, but she's walking it back. A huge disappointment, in my opinion.
Well, she did that during her presidential run as well. She and what really kind of teed me off about what she did is twice, at least 2 times on the debate stage, she was asked in front of a national audience. Again, this was during the debates. Do you support Medicare for All? And she raised her hand. And then the next day on a morning show in some local place that didn't get any attention, she's like, no, I misheard the question. Okay, let's just say that that's true. That's fine. That's one time. When you do that on the second debate and then you use this technicality, well, but your question was what I give up my insurance, which that wasn't. She's not stupid. She knew what that question was. And that, to me, showed she knows that that's a popular platform, and yet she's unwilling to support it, but she wants to at least confuse the public as to whether or not she supports it. That really, I thought, was just distasteful. And yeah, we see we see and that's why I think a floor vote on the House would be so important, is to actually see where people stand on this. Because it's easy to say that you support something in the campaign trail, but once you get elected, it's how you vote that makes the difference. And we can't even get that.
Unfortunately, back to that one reason why we are in the current situation that we're in, they may raise their hand on the stage, but if they feel like it's become the third rail for either votes or popularity, caving in to special interest groups who do not support Medicare for All, then the raising of the hand and then backtracking on it, it becomes a relatively easy thing to do. And by the way, I'm open to the idea of her, if she so chooses, to revisit and really not only listen with her head, but also with her heart. Because I have a sense that in her heart, she knows what's right. Let's see if she's capable, and anybody else. You know, people are entitled to change their minds about things.
Absolutely.
We've seen that with a lot of politicians who have changed their mind in the right direction. So I want to remain somewhat hopeful that anybody who has historically been opposed to Medicare for All can start, moving this forward. And that includes who's ever in office now and who's ever thinking of running.
You know, there's he's the host of another show. It's called The Young Turks. His name is Cenk Uygur. And a very funny thing happened during the presidential, I think it was the last presidential elections. He happened to interview Michael Bennet, the senator in Colorado. Okay. And he asked, he basically started off with, would you agree that Medicare for All would be like the Cadillac of insurance plans for the public? And Michael Bennet walked right into that and said, oh, absolutely. That would be the best of the best insurance. And so then the follow-up questions, well, would you support that then? You just said that is, the Cadillac of insurance, your words. Would you support that then with a vote? And of course he said, absolutely not. No. And I just thought it was so
That's bizarre.
amazing. Exactly. I mean, here he is admitting this is and this is, by the way, you can find this on YouTube, this clip. But he's admitting that it's the Cadillac of insurance. And I think the advantage is I don't think he knew who Cenk Uygur was. So I think that he was under the impression that this was just another corporate media outlet, perhaps, rather than a progressive outlet. So he may have not realized where this was going. But even still, that sort of depraved honesty is just stunning, because it does show in their hearts, most of them know that it's the right thing to do. But when it comes to, and I would say it's not even so much politics as it is money in politics that's driving these problems.
It is the money. And, the old phrase, follow the money. Even I remember 15 years ago, at least, a huge ad in the newspapers, Aetna insurance company, supporting what you and I are talking about. Well,
Really?
they got lost somewhere. I don't know what they figured out, that it wasn't in their stockholders' best interest. But there was a time that they were behind this.
Really?
So there's a lot of, it's one thing for money to be so heavily influencing what's going on in healthcare today, especially again with the hospitals, medication, and medical devices. But when we take ourselves away from the court, the money, and the politics, and then kind of look at what's going on underneath that might be obstacles to preventing ordinary citizens to jump on board with this. There's continues to be a tremendous amount of misinformation, lack of education, and the public relations of that people are reading about and seeing about that are convincing ordinary people that it's not in their best interests, which is really, very sad to me. A lot of fears, and they're so unnecessary. And the only way to really get around these unrealistic fears, it's got to be more and more education. Now, I don't want to change the chapter here, let alone the book, but we see what's going on in our country with other, very hot issues. And you'd think like common sense would prevail, and yet it's not. So I'm hopeful that this will happen. I don't see it happening soon.
Right.
I wish it would. But we've got to. There's the organization which I've quoted before, Physicians for National Healthcare. They've been around since the late 1980s that I know of. I was asked to actually become not a member as a physician, but just to join. And I'm friends with in social media a physician in Berkeley, and who's also involved in clean air. And she sees what happens to people that don't have clean air. And I've experienced it myself in the San Joaquin Valley when I was there for 10 years. But she talks about other countries that, in other industrialized nations that have healthcare insurance for 99 to 100% of their populations. And we see that they're, in fact, many of them living healthier lives and spending less money. They have less infant mortality. They have earlier diagnosis and treatment. I mean, the list is it's long, and so because our American culture started out with survival of the fittest, there is still this unfortunate mentality, even in healthcare, that you may not be entitled to get healthcare, or if you are entitled to it, you're going to pay. And that payment might cause you, over the long run, to go bankrupt because of medical bills. Bankruptcies, by the way, primarily are due to hospital bills. Or if somebody doesn't go bankrupt, then they are going to have to take out a loan, or they're going to have to get a second job. We don't see this being talked about in the local mainstream media. It gets a little bit of attention, but in my opinion, it should be daily. People should be,
right.
Just like the weather report. We get a weather report. They predict what the weather is going to be next week rather. May not always be accurate, but having said that, we just need to have more and more attention to this. And I think eventually we can overcome it.
Well, I think it goes back to the money, because if you look at the mainstream media, I mean, a lot of money is spent from pharmaceutical companies on these advertisements. And same thing with the insurance industry. And so again, that's another conflict of interest. Now you had made an earlier point. Two things that I want to return to, but one is the people that are against that would vote no, as far as the American citizens are concerned. And I think a lot of that has to do with the media. But there's this concept, and we hear this all the time, freedom, freedom. Free choice and freedom. What exactly that's where I think is a narrative that doesn't make sense. Because freedom as far as what? Because to me, freedom, if you're going to use the word freedom, that more applies to a Medicare for all system, where you have choices of treatment, you have choices of doctors. What freedom do they think that they have in the current system? This is what I don't understand.
Well, if a person today is working full time and the company that they work for is contributing to their healthcare program, their healthcare insurance rather, then they can then go to their human resources personnel, and they can look at what their options are. They want this, they want that, they want dental, they don't want dental, they want mental health, they don't want mental health. And so there are a lot of people that who are working full time, and they pay some for their insurance and their employer pays some. So there's a lot of people that say that if we had Medicare for all, they're not going to have those choices. It's not true.
Exactly.
It's just not. People want to promote it as it's not true, that they're going to somehow be forced into something that they don't want to be forced into. And let me bring up an interesting point. It's kind of like two sides to the same coin. We do see, and sometimes we should see, that there is a lack of trust today in our government. You've actually talked about it yourself, that there are some things that people just don't trust their government to do or not to do. And so that also gets factored into this Medicare for all, because Medicare for all would be a huge, so to speak, social program that is going to have to be managed by the federal government. And by the way, years ago, I thought maybe in 4 different sectors of the country to kind of break down the administrative issues. So there has been mismanagement of other federal programs. There has been waste. There has been fraud, and there has been abuse. However, those same concepts take place in the private sector as well. And if you want to see who has more waste, fraud, and abuse, our federal government or the private sector, well, then it's no contest. And I don't think, and by the way, I'm not supporting waste, fraud, and abuse, but I'm just saying that there have been federal programs that have been mismanaged. People joke about, well, we went up to send a rocket ship up in the toilet, cost $100,000. Okay, I get it, but let's get out of the toilet. let's just move forward and try and have a more humane country, where we actually wake up and have some deeper understanding that we really are all in this together. I talked about this in 1985, that we will remember things like I wrote in 1985 about what happens when there isn't an effective public health structure. And lo and behold, we see it now with COVID. Yeah. And you would have thought that with COVID, that would have been kind of like a time in our current here and now to say, wow, look at all the people now that are suffering because they don't have health care coverage because they lost their job. Well, when you lost your job because you got sick, sure, they pumped out a lot of money, which in part is causing inflation. But having said that, you'd think like, okay, let's wake up and let's really understand that we need a good healthcare system for everybody because it will, in the long run, it will help everybody.
Absolutely.
If people have that understanding, not only in their brains, but in their hearts as well.
Well, let me ask you. We hear Joe Biden tweets this out all the time. That healthcare is a human right. Is it? And what does that mean? What does it mean if we say that healthcare is a human right? Because,
well, okay, so what you bring up is the age-long debate since 1974, and that is healthcare a right or is it a privilege? And I will tell you that there are many people who are very bright and they're very articulate, and they can make a strong case for it's a right. There are also very bright, articulate people that can make a case for saying, no, it's a privilege. And the people that say it's a right, they do say that it's okay for our government to impose certain taxes on people to help those that are burdened by the free marketplace. Okay, so I'm not an expert in taxes. I'm not an expert in math, but let me say this. We already know that there are corporations and people that legally are allowed to avoid paying certain taxes. They're not cheating. They're legally allowed to. Or there might be billions of dollars still set aside in offshore accounts. It's not illegal. But there's a lot of ways for our country to have more money for health care. People are worried that they're going to tax the middle class more for this. Or even people should have more skin financially in the game, even if they're at poverty level. Maybe they should contribute $50 a month if they're not paying any taxes at all. But, that's like, it's time to stop picking on little people. And let's really look at where the money is at and how it could effectively be redistributed. And not just the 1% of the 1%. Yeah, they're part of the dialogue that we're having, but then there's the 1%. And then Then there's the 10%. Mm-hmm. I mean, it's, so the rights versus privileges. Well, people that say it's not a right, they say it's a privilege, and you have to work and you have to save. And so that when you reach a certain age, then you can have Medicare. Well, that has really worked for a lot of people, but times have changed. Not everybody is going to be around to make it to Medicare age. They're not necessarily going to have a job that helps pay for their insurance because there's this whole gig economy now where corporations have learned very effectively that if they only have somebody work for them for 31 hours a week, no insurance. So now they're on their own. And so you've got this program and that program and Obamacare and this care and Blue Shield and Blue Florida. It's such a patchwork of system. And the administrative costs to run all these programs and what we have now are huge. These countries that only have universal health care, their administrative costs are maybe 3%, mm-hmm. and ours are like 8%. That's a lot of meatballs.
Yeah, I guess so. It really comes down to whether or not healthcare should be, a commodity traded on the open market. I would say no.
Exactly.
Because, when it comes to being a commodity, there's going to be, the profit incentives in healthcare just don't make sense, right? Because companies, that are selling a product, Coke or Pepsi, whatever, they're going to compete, and it's very cutthroat. They're going to, it's not
and let them.
right.
Let them.
But
Who cares?
when it comes to healthcare, you're taking people's lives and jeopardizing them. And just the thing is, healthcare is not a commodity, and we should not. And even if you're, you can have a great job, and I think we've learned this in COVID. There can be a catastrophic crisis that
Exactly.
that is beyond your control, and all of a sudden your situation changes. And not only is that bad for you, but that's bad for the community. It's bad for public health in general.
You're absolutely right, and it gets back to that lawyer that saw his mother pass away because of profit over people. I was just today looking, and there's no need to quote the sources. People are free to, find their own information. But I was just looking today, and again, back to bankruptcy, medical bills. Well, 2/3 of all personal bankruptcies are due to healthcare, mostly hospitalizations. Of those, 20% of those personal bankruptcies are people that are over the age of 55. Then when we look at debt, almost 60% of all Americans at some point in time in their life have accumulated debt due to medical bills. That's 60%. So what I was reading is 70% of people in that population, they're cutting their food expenses. Bankruptcy. And then you talk about worry and anxiety. Well, since COVID, not since COVID, but 39% of the American public is more worried about their financial bills than they are about getting COVID. Now that's sad. And the list of this, like 33% of Americans through Physicians for National Healthcare talk about 33% of Americans, they're postponing a visit to their doctor because they don't want to incur the costs or the tests. And in fact, 20% of Americans sometimes skip a test because of even the copay.
Yep.
And then we've got about 65% of our population still today have financial concerns about what? Unexpected medical expenses. So you can't even live in the here and now. You're already anxious. What is anxiety? Well, it's about worrying about something in the future. Guilt is, the past. But why would we want to live in a country that's, say 60% even, it's on their minds. They're worried if something is going to happen. It really is, it's a moral, ethical issue that our country hasn't come to terms with about healthcare, and of course other issues as well of what we see unfolding today.
Well, and I'll give you an example of a catastrophic crisis. Again, let's look at Uvalde, Texas, the school shootings. Who do you think pays, for those medical costs for those students? I mean, I actually looked into that a while back, and it turns out if your child is shot in school, that's going to either affect your insurance or you're going to get the medical bill. That includes the ambulance to the hospital. That includes the care at the hospital. So if you're, working a minimum wage job and, your kid is shot and you don't have insurance, well, now you're in debt. Well, people don't, need to, not again, I'm not saying people are going to get shot, but there are instances of things that happen that you cannot prevent, that is beyond your control. And we're living in a society with climate change, with the issues with air quality. We have a sick society, and we don't have the infrastructure in place to properly care for our citizens. And that goes back to some people will say, well, how are we going to pay for that? Which is, I hate hearing that argument. Because it's like, how do we pay for everything else, right? but no, how would you, I mean, people would say, well, how are we going to pay for that? Well, obviously the answer is through
Right.
taxes, right? But the savings, talk about the savings, because currently if you're paying 40% of your income, which is what the average American budgets for healthcare or should be budgeting for healthcare. I mean, even if you took that down to 20% of your income, if you're paying that for healthcare now, the taxation that you would be paying wouldn't even be close to that, right?
That's what I've been led to believe, that people that share that this phrase of how are we going to pay for it? Well, we somehow don't have issues with paying for other things, was one point that you just brought up. And, you know, it's fine to have a good military industrial complex, but is it overblown? And if it's overblown, by how much? And then all the other things that we do, you know, spend money on. Look, you know, it's a free country. Yeah, so the federal government, they make huge money in taxes every hour of the day on people that continue to, unfortunately, buy cigarettes. Just as an example. And, you know, where's the public education on
Right.
how much money that's costing our country? Well, okay. So I think there's enough evidence out there to say that with all the administrative costs that we spend, back to 8%, whereas the other countries are doing 3% for administrative costs, that in and of itself is a huge saving. I want to go back to something that you just said, though, and this really is of concern to many physicians and other healthcare providers who have their hearts in the right place. And they bring up what you brought up, the infrastructure. Right now, there are certain areas of the country as we talk, and I live in one of them, in the city, where it might take 3 to 4 months to see some primary care doctors, or even a little bit longer for a specialist. This is a concern to healthcare providers who have their heart in the right place, but they also know and say, well, if all of a sudden, which we know isn't going to happen, if everybody were going to be eligible for Medicare for all, there's not enough doctors, there's not enough nurses, there's not enough advanced registered nurse practitioners and physician assistants to really cover Medicare for all as we talk. But let me say this, that's by design.
Mm-hmm.
That is not an accident. The number of doctors that we have in the United States has been severely limited to only allow a certain number of people into medical school at one time. And back in the day, I don't know how it is today, but I know that 20 years ago, the American Medical Association, I'm sure, has done wonderful things, but they also limited, at least back in the day, the number of people. And then the expense of going to medical school, the debt. I mean, really? You want to go into debt in order to take care of people, whether they want to be a dermatologist, whether they want to be a heart surgeon, a brain surgeon, orthopedic surgeon, reconstructing hands from injuries. I mean, you name it. Why would our country want to force medical students into huge debt? So they come out and, you know, it's not an easy thing.
Well, I want
Let me
to
this.
add something to what you said, because
Go ahead.
You mentioned that they limit the number of people that can get into medical school. Now, my understanding is that that's not entirely the limit is on the residencies that are available when you actually get through medical school. And so what we have, because of these, and this was actually passed by Congress, I don't remember when, in coordination with the American Medical Association, as you mentioned. So there are actually a number of students that graduate from medical school that go into debt, and they find that because they can't get a placement with residency, which has been limited, it's all for naught. They either have to wait until the next term to get into a residency, which of course, unfortunately, so we've literally got students that have completed medical school that cannot get into a residency because of these restrictions. And that is, to my understanding, I think that's what you were talking about. And I think people need to understand that. We have people that go through medical school that cannot be physicians because they can't get into a residency because we limit the number of residencies that a hospital can intake.
Well, like you, I learned something every day. I really was not aware of that. So that's just, more, sadness to the system.
But the other limit too is the cost of medical school. I mean,
exactly.
To get in. I mean, so there's so many impediments, and you do have to. And in terms of the shortage, yes, it's true that there is not perhaps enough medical professionals for Medicare for All right now. What people need to understand is there's currently not enough medical professionals for the system that we have now.
Exactly, especially in rural America.
And a lot of physicians are entering retirement age, and we don't have enough people even thinking about going into medical school to combat these retirements. And then, of course, a lot of physicians, I know a couple that have said, I'm done with the system. It's not worth it.
Yes. Yes.
So
we see that all the time.
We're losing nurses and doctors. And so we don't have, the system that we have is not working either. So the people that would argue, well, we don't have the physicians and the infrastructure for Medicare for All. That's true. But we also don't have those resources for the system that we have now, and it's getting worse.
For the here and now.
Right. Let alone the future.
Well, when it was 1985, and I thought this was going to be, a lot more improved and resolved by the year 2020, like I said, I was a gambling man, and I certainly, on that one, and I lost. So we're now in 2022. I can't take a guess as to when we're going to, even at a rate of slow, guided implementation in, state by state or section by section. I do know this. Sooner or later, we're going to have to join the rest of the world and do, I hate to say it, the right thing. I don't know when it's going to happen, but I don't want to lose faith, and I don't want to lose hope that someday we will come around and look back in the history books and say, well, this is how it was, and this is how it is now.
Well, you mentioned this, doing it by the state level, and you had earlier mentioned that Governor Gavin Newsom, the governor of California, had promised that in backtrack. Now, I've heard a lot of pros and cons about doing this at the state by state level, and I'm just curious: is that feasible? Because it doesn't seem as though that would work at a state level, only because you're still dealing with, again, you have insurance companies that own clinics and hospitals, and what do you think about that? Is that a feasible pathway to a national program?
Sean, I don't. It's literally above my pay grade. But let me say this: something, even if it were a experiment, might be better than nothing. And I know that you had talked about what would happen to the companies, the businesses, the corporations that are currently, making money in the state. What would happen if my guess is that maybe 10% would leave. I don't, because they're still gonna, these companies, they're still gonna be able to bill. They're still gonna be able to bill somebody, and their profits may not be as great, but if people can get medical care and just keep up with the rate of inflation at that, with the tax base. I'm talking about Medicare for all. You see, what's angered a lot of people, and to a certain degree to myself as well, I didn't like and I don't like the concept of saying, we should have free medical care or we should have free education. Everybody knows one way or another, it's not free.
Right.
There'd be nothing wrong with saying, why can't we have publicly funded health care and publicly funded education? And by publicly funded, that means taxes, it means corporations, it's not free. And so people that maybe for whatever reason don't have their thinking cap on, then they'll start resenting that word. All right, let's deal with that. By the way, Vermont proposed as a singular state a Medicare for all, and it didn't happen. And the only reason it didn't happen in Vermont, which is a very small state compared to California, the only reason it didn't happen in Vermont is because they couldn't really sit down with pencil and paper and say, how are we going to pay for this? Had they done that, Vermont may have been the first state. It's not over. Would I like to see, instead of state by state? Well, I would like to see it, nationwide. It's huge. Can I talk about something that's a little bit sensitive to all of this?
Oh, absolutely.
I can.
Absolutely.
When any person Googles Medicare fraud, some people, and it's probably accurate, have mentioned that as you and I talk, Medicare fraud in the United States is equal to approximately $60 billion a year. Now, in terms of the GNP and the terms of the vast number of dollars that we do spend on healthcare, I don't want this to sound wrong, it's not that huge a sum of money. I mean, it's huge to you and me. I mean, it's beyond huge. But we have people, for instance, in the state of Florida who recently got charged for bilking Medicare, a huge corporation who changed their name. And the head of the corporation testified. He took the fifth a number of times, and he was let off the hook. I'm not going to mention his name. But about 4 or 5 other people beneath him went to prison. And now it turns out, if you do research, that when severe Medicare fraud takes place by huge organizations, they sometimes end up settling with the federal government to the tune of 10 cents, 20 cents on the dollar is their fine. So this mentality of the Wild West of trying to bilk the government, and then knowing that if you get caught, if you're a huge corporation, well, you're going to spend, maybe you'll pay back 20 cents on the dollar. This business of, we want to be a tough law and order country, well, we should be when it comes to the right things. And Medicare fraud and waste and abuse and Medicaid and we can do better.
Absolutely.
It's a bad image. And so a lot of people think, well, if everybody now is going to be Medicare for all, the $60 billion, that could turn into a greater sum of money. I'm not saying that it would happen, but we need to, they say, well, there's not enough employees to monitor this Medicare fraud. You know what? We can do better.
Yeah.
We can do better.
On that note, I want to bring in our other guest, if you'll stick around, please. He's a hospital administrator, former hospital administrator in Canada, and I want to get his perspective on a lot of this too, because I think that can answer a lot of our questions about what kind of fraud is possible under a national system. So I'm going to bring my producer in too. So hello there.
Hi there.
Hi, Alan. How are you doing?
I'm pretty good, Sean. How are you?
I'm doing great. So I don't know if you've been listening to some of the conversation, but what is well, let me because Mackenzie has done a lot of research into the Canadian healthcare system, so I'll let her take the lead on this. But I am curious.
She has.
I hear that you have
Okay.
to. I hear that you have to wait like 12 months to even get in to see a doctor up there in Canada, even for like a heart attack. Is that true? I'm joking, of course, but that's one of the.
Here, well,
You're
let me
asking.
go
You're
ahead.
asking Mac. Okay.
Yeah, I'm not actually here as any kind of expert at all in the. I've done very little research on the Canadian medical system, other than going to Canada frequently and finding out that it does not apply to Americans, no matter how badly they're bleeding. But I'm just here on the show today. I'm a producer, but I'm here just as a guest, as an average American who has to use the medical, our medical system a little more than the average American. And I invited my friend Alan here as an average or almost average Canadian who also takes advantage of takes advantage is the wrong term, but he's also utilizes the medical system quite often. So between the two of us, we both have a lot of experience with our individual
Well, and Alan
systems.
used to work in a hospital as well, correct?
Yeah, he did. I'll ask him in a second. And so basically the first question really, Alan, is what did you do in the medical industry in Canada, and do you think being in the system to some degree would change your experience getting healthcare in Canada?
Well, I've been retired for 15 years, so my experience is not experience in the industry is not that recent. I worked for about 20 years in hospitals in the Toronto area as director of finance. Your last question, what was that again, Mac?
Oh, I was just wondering that, at the time when you were a director of finance in a hospital system, did you get, say, better health care because of it?
No.
Do you think?
No.
You were the same as any other person in
No, same as any other person.
Aside from the fact that, were you actually working in the hospital?
Yeah.
Okay, then I guess you're a little closer if something happens.
Well, yeah, I mean, I should maybe I should backtrack a little bit. If I'm there and I had to go to Emerge, might I get special treatment? Well, one or two times, I would say that. I would say that happened. Yeah, I'd get the director of Emerge, come right over, but I was nice to him.
Well, it was because you were nice, probably.
Yeah.
Not because they needed you back at work quickly. All right. So let's cut to the big major question. The first thing that comes into everyone's head when we think about Canada's universal healthcare system, and the big fact myth is that in Canada, because the government is providing in one form or another the healthcare, that there's no sense of urgency, that there's no that you can't get a better doctor, a faster doctor. You're just stuck in the system, and it's going to take forever. Now, first off, before I just have a couple of things to say before you answer the question of if you think that it takes you a long time to get health care. I'm just going to throw out that, as was mentioned during the podcast interview, I'm not sure what people in the United States are worried about in comparison to Canada, because it takes us a long time. I just scheduled an appointment with my primary care physician for my annual physical, and she was scheduled. I did a couple of weeks ago. It's for the end of July.
Well, let's not forget that if you
not
don't have insurance and also you don't have any money, the wait time is like forever because you're not going to get into an appointment.
Yeah, in one of the low cost clinics, quite potentially, yes. And now, of course, my annual physical is not necessarily an urgent matter, and I just need to get in the mindset that if I want it to happen annually each year at the same time, I need to plan 3 months in advance to make that happen. But then I also have a lot of more urgent medical needs that, different appointments with specialists that I need to have. And those do not, you can wait a long time for those. Now, I've always been of the impression that this healthcare is slow in Canada is a huge myth. And then Dan here, he directed me to an article that was published by something called the Fraser Institute, a Canadian organization. Obviously, Fraser that's headquartered in Vancouver, but they have offices all across Canada, and they are saying that yes, that's true. And they're saying that that's the worst thing about Canadian healthcare is that people do wait far too long for non-emergency type things. So, Alan, what do you have to say about that?
Well, I mean, I do think that Americans are pretty good at inventing myths about the Canadian and other systems because they just have a very difficult time seeing across their borders. But it doesn't mean that some of it isn't true. I mean, our wait time's often too long. They certainly can be, but I think what people lose track of is that it can very much depend on how urgent things are. I mean, people can, sure, if it's an elective surgery, a wait time might be, I guess what I would phrase as too long. But if it's urgent,
well, if something's not urgent, is there a time?
Yeah, I mean, if it's urgent, things tend to happen right away. I mean, I went in with a heart issue with blocked arteries, and they kept me in a community hospital until they were ready to do a quintuple bypass operation. That happened the same week. Things aren't urgent. You're gonna wait longer. There could be a significant wait time for something like an MRI. But if you really need it, you're gonna get it the next day.
What do you define though when you said like too long? What do you define as too long? Can you give an example?
Well, too long is a phrase that Canadians like to use. I don't think I could quote a specific wait time for a specific procedure, and if I did, it could be out of date. And I guess it can depend on the circumstances and exactly where one is. Certainly, I've had long waits for.
Yeah, will there ever be any instance in your experience where somebody would have to wait as long as a year to get some kind of...
No, years. A year sounds like A year sounds like a real stretch unless there's
Now,
an
I've read
unknown
that another
circumstance that
criticism.
leads to it.
Yeah. The another criticism of the Canadian system is that rural areas are not as well. I'm not sure what they're comparing that to as well. Well, obviously, they're saying the rural areas do not get the same medical services that you would get if you're living in the city. And I think that's true.
Just out of curiosity, would you say that they do in the U.S.?
No, they absolutely don't. But I suppose looking at, if we're looking to Canada as a model to try to emulate, as far as mental health, or not mental, well, speaking of mental health, since I accidentally said it, now I do know that the universal health care in Canada does not include dental.
It doesn't include dental. Clearly it's a big priority of the left in Canada right now is to try to get universal dental insurance. In fact, since the NDP are currently, it's a minority government, and the NDP are propping up the Liberals, many believe that they're really going to force some form of universal dental insurance plan on the country in the very near future. But
let me here. Hold on a minute, Dan. You and I talked about that.
Yes.
If we were going to emulate a healthcare system, Sweden would be one to consider. Now, as far as I'm aware, they include dental, vision, everything under that system. Is that correct?
To my knowledge, that is correct. I also, I think we, shared with you or Mackenzie an article about how universal health care is delivered, or quasi-universal health care is delivered in Germany, that appears to be a blend of allowing Americans to have more choices, yet at the same time more, universal. And I read the article, and I would have to read the article about 6 times and perhaps seek consultation on really understanding the business model. It was submitted to me through a friend of mine who's a PhD scientist, and thinking that Germany has a good healthcare system. And after that article, I did nothing further to identify the how it's working or how it's not working. The article that I sent to Mackenzie seemed to point towards the United States maybe not trying to emulate nearly as much the current Canadian model, of which, by the way, I know even less about than the United States. What's
obviously
happening
better
here?
than what the United States has.
Well,
there may be
right.
flaws or things that could be improved upon.
One thing that must be understood, and I've said this, I think, to you, Mackenzie, what has to be understood is that the United States continues to be, for better or worse, the most powerful nation in the world. And in terms of money and also brain power, a huge amount of brain power. Obviously, we welcome anybody from anywhere with brain power. I mean, my goodness, we are, okay. So we got to the moon. Now, there was competition with another nation, and a huge amount of money was spent to get to the moon. But how did we do that? Well, because we were motivated. We wanted to be the best. And I've been saying since 1985 that if we put our mind to it, we literally could have the best universal healthcare system in the world without the huge taxes that the Scandinavian countries do pay.
Now,
They have other
Alan,
benefits.
Well, the one,
Alan,
Go ahead.
how
Go ahead.
how do you feel about the taxes in Canada? Do you think that you pay an exorbitant amount because healthcare is included?
so you're asking me, Matt?
Yeah, I'm asking you. Is it even broken down?
Well,
Or do you even know when you pay taxes? Do you even know when or how or much goes to what? And
to an extent you do. Only to an extent, because a lot of it comes out of general tax revenue. Like in Ontario, like healthcare is a provincial jurisdiction. There's a federal health act that basically says that provinces have to provide universal health care in order to get the federal contribution, and that there are certain rules. For instance, you can't have co-pays and things like that. So provinces are not allowed to impose any co-pays. In terms of specific taxes, there's a 2% employer tax, so every employer pays 2% of their payroll for health care. There's a personal health tax in Ontario that ranges from 0 to, I believe it's either $900 or $1,200, depending on one's income level. There's also a health care. Sorry, what's that per year?
Per month or per year?
Per year. There's also
that's taxes, though, correct?
Yeah, that's through your tax return. Yeah. So you're not going to pay. You're not going to if your income taxes. If your tax rate is very low, you won't pay that. And there's also a healthcare surtax on the higher brackets. And that's specifically designated. Clearly, there's a provincial sales tax of 8% on everything, and a big chunk of that goes toward healthcare. So you're paying you're clearly paying a lot of taxes. You're paying more taxes than Americans pay toward healthcare.
I don't know the numbers, but it doesn't seem like you're paying crippling taxes. Like you're paying a third of each paycheck toward taxes.
No, sorry. Run it by me again. You're what?
Oh, I was just saying I don't understand, or I'm not sure how the numbers work, but it doesn't sound as though like that you're bringing home very little of your paycheck because so much of it goes.
It depends on it. It's quite a graduated rate, so it very much depends on your income. Certainly, at upper levels, you're clearly paying.
But at upper levels, you have more money.
Yeah.
So you're still not noticing. You're still not really hurt by the amount of tax that's coming out because you have more money for yourself at the same time that you're giving out more for taxes.
I would say that Canadians complain less about taxes than Americans. Canadians complain less about just about everything than Americans. But the one thing Dan was saying about a certain level of painlessness in the U.S. as you shifted to a universal health care model. mean, the one thing that the U.S. experiences right now is a huge employer payment, at least most employers, for that goes to insurance companies. So that a tax on employers, I mean, they could actually end up with a lower payment than they've got now. Various ways of handling it, but there's already that base built in where an employer expects to be paying a load of money to insurance companies. So I mean, to me, it's completely inconceivable that the U.S. is, the only developed country that relies so heavily on insurance companies. I don't get it, and I don't get the argument that oh, gee, you're in a terrible place in Canada because you're letting the government come between you and your health. And it's like, first of all, it's a myth. It's physicians control what is medically necessary, and it's covered if it's considered medically necessary by physicians. That's how the system works. And I've heard so many horror stories from friends about insurance companies telling their physician that what the physician said was medically necessary was really not medically necessary. So
that's in the United States, right?
Yeah, in the United States.
Yes.
Do you have? Are there private insurance companies in Canada at all?
Yes. Because certainly for drugs, until you're 65, the government does not cover drugs. So you do have to rely on private insurance companies, also for dental and certain extended services, like say chiropractors or what have you, that the government insurance does not cover. That's through private insurance.
What about mental health care?
What's that?
Well, does the Canadian government cover mental health care?
Mental health is fully covered. Yes.
Fully covered. Okay.
Yeah. So you need a psychiatrist. That's covered. But
not necessarily the medications that they prescribe.
No, not medications. Medications are covered when you they're covered when you hit 65.
Now,
so,
what if you?
I mean, I take a ton of medications.
Ill?
I don't know what they cost.
Yeah. So what if you say you have schizophrenia at age 25?
Yeah.
If you have a severe mental illness, then do you go on some form of a Canadian disability where your medication would be covered? Or do you even know?
I don't think there's a simple answer to that question. You're talking about a government disability.
Yeah.
I mean, you could end up being on some type of. You could end up being on some type of a social assistance / welfare program, which certainly would cover medications.
But there's no federal, like we have a federal disability program. There's no big, large scale system like that, to your knowledge.
I can't think of anything that would be totally comparable in that area.
Well, now, because in the United States, there's at the federal level, there'd be Social Security disability. But Mackenzie makes a good point, though, that's kind of, and maybe Dan knows about this, because in the United States, too, a lot of the social welfare benefits derive at the state level, correct? I mean, it goes through the state, so a lot of that depends on how the state budget and so forth. But
Well,
that would be Medicaid, correct, at the state level?
yeah, Medicaid, or in California, Medi-Cal, but Medicaid is actually a federal program. And what the federal program does is it gives lump sums of money to the states to administer the Medicaid program. So I recently learned, just as an aside, that there's about approximately 14 states that are identified as red states that have turned down expanding Medicaid in their states. They didn't want to participate in expanding Medicaid. While we're at it, keep in mind that Medicaid is, of course, another huge federal program. Medicare for All would not have that layer of administrative costs, and many employees for Medicaid would end up working for Medicare anyhow. But again, there would be a substantial reduction in administrative costs. In terms of Social Security disability, as you had talked about, once a person is approved for Social Security disability in the United States, they've actually already put in enough quarters to receive that through the Social Security Administration. It then takes 2 years to then receive Medicare, regardless of your age. So say you're 45 years old, you get involved in an unfortunate motor vehicle accident, you're now unemployable, you're in a wheelchair, whatever terrible things could happen. So you get Social Security disability, but it's another 2 years until you then get full Medicare coverage.
That doesn't make any sense at all.
In the United States. And by the way, just as an aside, one of my physician friends pointed out to me, he asked me the question, he knew I was going to be here sharing time with everybody. Why is it that, Americans can get their medications from Canada approximately 40% less than
Yeah, I was
here?
just going to ask Alan
And
that.
of course, we know why.
'Cause-
Yeah, we know why. It's because they can. I don't want to sound too feisty here, but the cartel is different.
But
Yeah,
actually, there's got to be laws in Canada, though, specifically limiting the prescription drugs. Because, I mean, if you've got the same insurance, if you've got an insurance system that you have to pay into that for pharmaceuticals in Canada, I would think you would have the same price problems that you have here. So are there specific law? I mean, obviously, it seems like the Canadian government has more regulations in place to control pricing of drugs. Would that be fair to say?
I mean, I think that's fair to say. I wouldn't. I don't think I'm qualified to indicate exactly how how prescriptions are a lot cheaper in Canada than they are in the U.S. I think that.
Well, let me take a guess.
Yeah.
I mean, I'm not an economics person either, but it sounds like if that the economy is going to demand what it can take, and if all Canadians are must pay for their medications until they're 65 years old, that's a lot of people who have to go and buy medications, and a lot of young people, a lot of people that are going to need the prices to be lower in order to be able to afford them. Whereas, so I would think the prices would stay lower just so the consumer base that is available to the Canadian pharmaceutical companies is able to come and be consumers. Whereas
I don't think it relates to the consumer base. The vast majority of employers have do have drug plans.
Oh, okay, so that's kind of the same as it is here.
Generally it would be something like 25% of the premium is covered by depending on the union. It could be where it could be 100% employer, it's going to be 25% employee covered, 75% employer.
So just not to intrude, I just, as you were talking, I went to Google, and anybody can go to Google and you'll find, some pretty accurate information, such as cheaper drugs from Canada, a reality for U.S. consumers. Why is medication so much cheaper from Canada? And basically it has to do with price control. They have set up guardrails that are different than the United States, where pharmaceutical companies can charge what the market will bear. And in Canada, there are caps where you can't cross the line.
Now,
that makes sense. I just hadn't Googled it yet.
Yeah, well, I had spare time.
Now, Mac, you had mentioned this earlier, and I want to see what Alan and if Dan has any comment on this. Let's say that Mackenzie goes to Canada and as an American citizen, and she is injured. She breaks her arm or something, and so she has to go to the hospital. Would she face the same? I mean, I can't imagine she would face the same financial bill in Canada than she would in the United States, even having to pay out of pocket for it, right? I mean,
well, my personal experience with this is that when you walk into the door into the Canadian ER, there's $1,000 Canadian, a little over $1,000 Canadian fee, and I'm sure that, I don't know if that varies or if that's countrywide or province wide, but there's you have to pay as a citizen of another country $1,000 just to be seen.
Is that a deposit or something, or is that just?
I'm not entirely sure because I didn't pay it and I didn't go any further. But
because that just seems.
Yeah, it's like I think I'm gonna wait till I get home, right?
Yeah, I think I think that it was more like $1,000 toward the total amount that you were going to be billed. But it's not like they give it back if you don't need that much. I think.
Okay, I mean, there are in terms of how it would compare to what somebody would be paying out of pocket in the U.S., I just don't know. I mean, certainly, I was in charge of billing to non-residents, and there's a certain schedule of fees that one charged for something basic, and my recollection was at the time I was working there was like a standard non-resident fee for emergency services, and it was something like $150 Canadian. I do recall Mac's experience. I heard it from my brother of this large fee, but that's kind of a new one. That's kind of a new one to me. And clearly for an inpatient stay, there's a standard daily amount. I think it was a little bit higher if you were in a specialized unit, and that could be covered if you bought a traveler's insurance. Before your trip. Then the hospital would just bill the insurance company.
Well, that brings up another question, though. I mean, if we're going to talk about a Medicare for all system, why should we limit that? I mean, to citizens. I mean, because this brings up the whole point about quote unquote illegals and so forth. And the same thing in Canada. I don't understand if I mean, is there a fear that it's going to be abuse or something? I mean,
well, it could
Yes.
very easily be
Yes.
used by people living near the borders. Now, I've heard that in the UK, I have not tested it. I should. I've heard that in the UK, if you're a visitor and something happens, then their health care system that's basically the United Kingdom taxpayers are going to pay for your medical care.
or is that the European Union that maybe?
Yeah, it might have been the European Union when they were part of it, and that was what I was going to say. Is there's probably not a fear of it to the UK of other people flooding their borders and coming in and getting care, because the neighboring countries all had their own care. Why would they?
I mean, I should interject just so there's no confusion. Yes, there are non-resident fees, but like for instance, in Ontario, if anyone shows up at Emerge, the hospital's required to treat them.
Yeah,
They'll
I think that's
bill them, but they're not going to turn anybody away and say we can't, pay or die, or whatever expression one wants to use. But
not like in the country like, say, Uganda, where they'll let you in the hospital, but they won't let you out of the hospital until you paid your bill.
Well, and I want to just interject on a point there too.
Yeah,
There's
that's called that's called they put you in debtor's prison.
Yes.
Well, there's sort of a myth too that in the United States we have a similar system where you're talking about where if you arrive at a hospital they can't turn you away, and I just want to qualify that that's not entirely true. If there's a life-threatening emergency, they can't turn you away. But other than that, they absolutely can, and they often do. It depends on the hospital and whether or not you're insured and so forth. So, it's not the same as Canada. I mean, and people need to understand that you can be turned. If you go to the hospital and it's not a life-threatening emergency, and that law stems, by the way, from the pregnancy bill. I mean, that's where that you must treat comes from. Is to preserve a pregnancy, but that's been extended. So, unless it's a life-threatening emergency in the United States, you could be turned away from the emergency room. And unfortunately, a lot of people in America are using the emergency room as their primary care physician because that's right. They don't have one. And of course, that's a very ineffective system, not to mention a very costly system. So is that, so, I mean, in Canada, it is, if you turn up there, it doesn't matter. They have to treat you, or is it still kind of like it has to be life-threatening?
Correct. I'm not sure every province is the same, so I'm speaking in terms of the way it was in Ontario, because I kind of got involved in it myself. Like at one point, our collection rate from non-residents was so bad that I instituted a policy, which several hospitals had done, which was that we asked for a payment in the emergency department up front for non-residents. And we did a press release, and the Ministry of Health was getting a little bit concerned that if somebody decided they were unable to pay up front, we would turn them away. And I said, no, absolutely not. And they said, good, because that would contravene the Health Act.
Because I've got a bunch of listeners right now fleeing across the Canadian border to the hospital just to get care right now as we speak. So hopefully we're not giving them that information. Isn't there a human rights convention too that has to mandate healthcare at some level? I mean, the United States would certainly be a violator of it. But again, I do believe that the United Nations defines healthcare as a human right. Um,
True.
and yet,
As does the World Health Organization. Both.
and the United States is we're a signatory of the United Nations. So it boggles the mind, and as is Canada, that we can just kind of flaunt that, because obviously it's not a human right if you don't have access to it.
Yeah, it begs questions. So, how do you define a human right?
Well, I think that the Human Rights Convention probably clarifies that.
Well,
But
I mean, in the case of case of healthcare,
so
Well, we need to wrap this up because
this has been a great
babysitter.
great conversation. I've learned a lot. I want to thank our guest. Hopefully, you guys will come back and talk about, because healthcare is a very complicated issue, and we're going to be on the show focusing a lot about the different avenues of healthcare and the different problems. Because, I mean, we've got a system where a lot of people are suffering and needlessly dying, and obviously there's no quick solution. It would take time to implement a Medicare for all type system. Obviously, how much time, I think you can argue is not as much as some would have you believe. But the one thing, and Dan kind of alluded to this too, the advantage that the United States has right now, being the only developed nation that doesn't have a healthcare system, is we can take the best parts of each system, and we can go to Canada. We can say, okay, we're going to take the best parts of this healthcare system. We're going to go to Sweden. We're going to go to Germany, and we can develop a top-notch system based upon the experiences that other countries have had. I mean, if you look at Canada, if you look at Sweden, they have a track record. They have a history that we can learn from. So we wouldn't have to start from scratch. We would be able to implement a system that would be very effective and accessible to everybody. I think we can all agree to that.
I agree to that.
I mean,
I do too. Fortunately, I have no power to. I think in general, America just doesn't like to follow anyone else's lead.
One could say profound, another could say, well, that's just total simple logic. But yeah.
Well, and I think Dan alluded to this too. I mean, it's this idea, and the problem with America is just this idea of freedom. Right? It's like, oh, well, no, capitalism provides freedom. I get freedom of, which again, I just find like an absurd argument, because in Canada, freedom is if you're sick, you get to see a doctor. Where in America, that is determined by the insurance company that you have, the financial situation that you have, and if you're one, and that's what you look. We have low-income clinics in the United States, right? The problem is that not only is the turnover so high because the physicians just burn out, but there are long waiting times, and you're just not going to get the same quality of care at a local. You're just not, and that's not because the providers don't want to provide quality care. They do, but they don't have the resources themselves, and they're not adequately funded. And they're overworked, and there's burnout. I mean, so we're really inflicting a lot of damage on people, on the poor, and a lot of burnout on physicians. Now, I do want to ask one quick question of Alan. One of the arguments in the United States against the Medicare for all type system is that the physicians are paid such low wages, and whereas in America, they're paid decent wages. What is your? I mean.
Well, I mean, I've actually had this discussion, back a number of years with American friends, where we were sort of, comparing what physicians made, in the U.S. and Canada, and typically. In Canada, you won't see specialists with some of these supernatural levels of income that you'll see from some renowned specialists in the U.S. but we were comparing like hospital positions. Normally, hospitals don't employ physicians, only in a couple of areas. Like, for instance, hospitals hire pathologists, and typically hospital physicians will head departments, and they'll be paid a stipend as a department head and something like that. But essentially, it's fee for service, and there are caps. But it's a pretty good level of income. I mean, if you're, and if you're like a radiologist getting fee for service, typical, and again, I'm thinking back 20 years and 20 plus years, and physicians on staff were generally starting at about 300,000 Canadian, and somebody, I mentioned a radiologist on a fee for service basis, and they were going to be well above that. So there was a whole lot of scare stories when Canada first adopted a universal health care system, and doctors threatened strikes, and they were all going to move to the U.S., and it all settled down. And there's just no opposition.
Somewhat recent?
What's that?
I'm sorry. Oh, I just figured that Canada kind of always had
it. It's not always, but I'm talking. I'm talking like maybe 50 years ago or so, or maybe less. I lose track of time. I get old and lose track of time.
You were around for it.
I was around. I was around. Let's put it that way. I was around before there was universal health care.
One more quick question, though. What about education? Is it when you become a doctor in Canada, are you basically putting yourself into debt for half of your career?
Quick answer, no.
No. Okay. Quick answer is good. Just curious.
Okay, well, we're going to wrap it up there. Thank you, Alan. Thank you, Dan. Dan, where can people?
You're welcome.
Where can people learn more about your organization? Is there a website they can go to?
Well, let me share this with. No, there is not. Let me share this with you. When I was living in Orlando, I applied for a EIN, Employee Identification Number, with the Internal Revenue Service. And so it is with the Internal Revenue Service. It is listed as the healthcare voice. Having said that, there's no website. Occasionally, I do pro bono work. Occasionally, I might get involved, just once in a while, helping somebody out. When I do work for fee, it is on which we didn't cover in the show, a sliding scale fee, which is another option for people to purchase or pay for their healthcare insurance, which that's a whole another show. If people have a pencil and paper available, or they want to listen to this later, I'm always glad to talk to anybody. In Florida, my area code is 561-503-1403. And on email, I'm Dan, DAN46, MSW. That's my master's degree in social work, MSW@yahoo.com. So even on social media, occasionally I've told people privately, if something I can do to help you. Fortunately, I don't get a lot of requests, but I am retired for the most part, and this show has motivated me to open up my eyes a little wider, and I made up a phrase a long time ago. It's not over until the skinny lady eats the last cookie. And I've got a hunch it's not over for me.
Great.
So I'm going to continue to let my voice be heard and help other people let their voices be heard as well.
Great. We're out, and so Alan, we're on our way to get healthcare right now as soon as the show wraps. So we're going to be staying with you and getting our healthcare.
Okay, good.
That is what I want to thank everybody.
I think it's good.
Well, we're going to be staying a while because we have a lot of healthcare needs to get through.
Right.
Okay, thanks again. You are listening to Coup Save America. I want to thank all of my guests, and we will be back next Tuesday with another episode of Coup Save America. Thank you so much for listening. Have a great day.